Good morning. So I want to welcome you all to this MS Views and News, MS Symposium here in Coleman, Alabama. I'm saying it like that because there are people online right now as well. So we want to thank everybody for being here, and I want to thank our wonderful sponsors. So we had, supporting the program, is SANDOZ, which is a division of Novartis. And our exhibitors, we had Alexion, Banner Life Sciences, Biogen, Bristol Myers Squibb, EMD Serono, Genentech, Novartis, SANDOZ, and Viatris. Why don't we give them a round of applause for supporting the program? Thank you very much. For everybody that doesn't know, my name is Stuart Schlossman. I too have multiple sclerosis. So next we have Dr. Frankie Preston. He's a licensed psychologist and licensed marriage and family therapist. His office is in Madison, Alabama. He's a psychological elevator, psychotherapist, consultant to physicians and psychiatrists, has worked full-time as a mental health provider for 40 plus years, married for 43 years, 3 children, 5 grandchildren. We could go on and on. But we're gonna let Dr. Preston have the microphone now. He's going to speak about relationships, intimacy, and communication with your partner. He's going to be speaking for about 30 minutes, and then we'll do 20 minutes of Q&A. So all stick around, and let's get started.
Hello, I'm glad to be here, and I'm glad that you all are here because your interest and attendance, of course, makes these kind of events possible. You might already notice that I'm kind of slowing this pace down. And the reason is, I have found that if you try to get 90 seconds out of every minute, you might be burning your nerves up. And I know, because I've done it before. And so today we're going to talk about the topic, and it might be a little different than it might appear on your flyer. If you look at the topic, you'll find that it talks about things that are relevant to couples. We're talking about relationships, partnerships, intimacy, communications. And I don't want to be deceptive or pretentious, but I think in order to address couples, we have to first address individuals. It takes 2 to make a couple. And so I think it's very important that when we look at those topics like relationships, communications, intimacy, that each individual brings their own agendas into those couples. And to start that, I would like to call attention to another factor, and that is today we've mostly addressed physical problems. And the physical problem, of course, is MS, but there is also a mental dimension to MS, and many of you have had that experience as well. And so in order to address that whole issue of couples and communications and so forth, I've prepared a 4-page handout that you can look at, and I'll refer to as we cross that path. And then I've also prepared you with a 2-page handout that has to do with monitoring your MS symptoms. And I caution you not to mark on it because you can make copies of it and you can do your own recording, and so that might help you keep up with relapse material as well as share that with your treating professionals and team. And so before we begin, I would like to just kind of invite everybody to take a deep breath and slow things down a bit and let some of the tension loose in your neck and your shoulders and get ready for Mr. Toad's wild ride. Because we've got a lot to cover here, and I'm not going to go over all of those 4 pages. I'll simply make reference to them because you can look at those at your own time and your own pace. I was glad that our last presenter brought up some matters that have to do with sensory mechanisms, the word proprioception. And basically you'll see in the handout that I've referenced the 5 senses, which I refer to as VAKO, V-A-K-G-O. And proprioception is part of that whole sensory mechanism, and that helps us to keep balance and to know where we are in terms of our surroundings. And one of the things that we're going to use it for is to recognize that VAKO, vision, audition, or hearing, touch, taste, and smell, is the only way we get information. A lot of times we take that kind of for granted, and we become sort of a hostage to our environment, because wherever we put ourselves, then we're exposed to those sensory mechanisms. As you will read in there, I put things like the NBA, NASCAR, and NFL, the Super Bowl, the lottery. Why do people want to go there and do that? Well, because they get all 5 sensory experiences at one time. And that is what many of us call fun. We like fun. But the other thing, like squeezing the 90 seconds out of a minute, is that those events can sometimes be sensory bombarding. Because when we get that information through VAKO, all this stuff out here, then we are inclined, what do we do with that information? Well, most of us we take that information in, and once we get it up here, then I'm going to draw myself a bubble. And we have what we call internal dialogue. So we self-talk about it. And today, you've probably watched the presenters and you've looked at your materials and you've probably internally dialogued about what's coming in. And right now, we're doing that same kind of thing. And that internal dialogue very often moves down really quick in a nanosecond. And it goes into this filter. And so the presenter before talked about being off balance. and then we fall. If you've ever done that, I have. I did some internal dialoguing after I fell. And thank goodness I had a filter, because it caught the trash before I said it out loud. So this becomes cleaned up, and then we internally dialogue about it. And at that time, we have the feelings that come. So I might be frustrated, I might feel embarrassed, and usually then we have anxiety and depression that comes in to fill the gap from that anxiety, the anxiety. One of the things I want to call your attention to that I have referenced here is that while we're doing this, this process of interacting with our environment, we are also doing something else that our autonomic or automatic nervous system has us to do. And that is when we're doing this internal dialoguing and so forth, one of the things we sometimes don't recognize is, what do we have control over? So I want you to imagine just really quick about two of the most important parts of your body. Don't say anything. Just imagine two important parts of your body. And that is going to be your index finger on your dominant hand, I'm right-handed, and your nose. And so if you take those two and you touch it, like right here, then that is where your control stops. Anything out here, you don't have much control over it. But you can work from here back. And if you're going to communicate, you're going to be a partner, and you're going to have intimacies, you'll come to recognize that sooner or later. For many, it's later, maybe sometimes too late. But the important thing is that just as we try to squeeze that 90 seconds out of each minute, sometimes we find ourselves putting a whole lot of energy and time and resources in trying to control all of this stuff out here. People, places, situations, and the only thing we got control over is from here back. So some of those things that I've already mentioned is what I call an inside job. From here back, I can make certain decisions where I go, who I'm with, what I talk about, that limits the kind of sensory inputs that I get. And so if you know, when we start looking at things like conflict, the things that we worry about, the things that we are often what-ifing about, is out here. It's all out here. And we want to control it. And if we're not trying to control it directly, then sometimes we do it by investigation. So I'm going to try to find out about all this stuff out here. Manipulation, frustration because I can't change it, and then that all converts into some of these anxieties and the depressions that we experience. A long time ago, in the 1870s, a French neurologist named Jean-Martin Charcot, after examining a whole lot of post-mortem cadaver brains, he noticed plaques and lesions on those brains, and he was the guy that came up with the term multiple sclerosis. Multiple meaning many, of course, and sclerosis meaning scars or hardening of the nerve cells in the brain. He also, I don't know if he did this intentionally or not, but when he was describing multiple sclerosis, he said that multiple sclerosis was best described by referring to mystery symptoms. It's another kind of MS. There's two kinds. There's multiple sclerosis, and then there's all these multiple symptoms that we see, and I've seen a lot of folks that can't explain or account for a lot of the things that they're feeling and a lot of the things that they're experiencing within their bodies. At the same time, we notice that they are having a lot of mental traffic about those symptoms. And a lot of times we see that they're awfulizing and catastrophizing with this internal dialogue. And the feelings that are coming out is hopelessness, helplessness, and anxiety about how we're going to manage our lives and our pain and maybe even disability. At the same time, Dr. Charcot noticed that depression was a big feature in folks with MS. And so depression occurs in about 50% of MS patients, which is about 3 times more common than the general population. 40% of our partners experience depression as well. And the types of anxiety that we look at are generalized anxiety, agoraphobia, social phobia, simple phobia, obsessive compulsive disorder, separation anxiety disorder, and social anxiety disorder. Anxiety, some of you probably experienced it, has a physiological connection as well. And when we really go for a lot of the worry and so forth, we see people that will frequently have heart palpitations, shakiness, sweating, breathing too fast, muscular tension, racing thoughts, poor memory, and so forth. A lot of those that I've seen in the emergency room when I walk in and they've been cleared of not having a stroke or a heart attack, and I say, "Can you tell me what was going on?" they would say, "I almost died. I thought I was dying." Now, I wouldn't, thank goodness I got a filter. I wouldn't say, "Well, how would you know?" Because you haven't done it before. You're here. But the important thing with some of the handout materials is that we do have certain control over what comes into our system by who we're with and where we are and some of the things we discuss. But the things that we often worry the most about, if you'll look on your handout on page 2, are these 9 dimensions. And the 9 dimensions are things that we are forced to do to live, to function. Some people do them without ever knowing it or discussing it. So one of the things we can do about it is we can define those for ourselves. We can modify those. We can even redefine them. But the difficult thing is that they are all intertwined. They look separate. There's 9 of them, but they're all intertwined. And the other thing is that we have to negotiate a lot of those, not only within ourselves, but with our partners. And after that, you'll notice these things that I refer to as the quick 6. And the quick 6 are some things that you might be able to incorporate as tools when you communicate with other people. And I won't go into details about those, but after that we see that, or number 2, is not only what we say, but how we say it, and what kind of things we very often garnish our communications with that are nonverbal. And then back to our last presenter, the next item on page 3 is about what I call the 3 Ps, and that is making progress. We don't expect perfection, and preferably with your partners. The important thing there is that if you're doing this inside job, trying to manage what you can emotionally and mentally, then you will sometimes get distracted. That's one of the reasons why some people will say that's divinely located at a spot where you're most likely to overlook it. So you can't go around like this all the time, knowing what you can control and what you can't control, or you couldn't function. You couldn't eat this nice meal we had, or prepare food, eat the food, because we can't go around like this all the time. But we forget. We forget. And so a lot of the materials that we have here for your reference is about trying to plan so that you don't have as many mental or emotional relapses. The MS patient is always concerned about those relapses, and we want to increase those periods of remission. And one of the questions that I frequently get asked is, how can you prevent that? Or is there something I can do? Is there some way I can kind of control that? And I'm like, well, you can't. We don't know what cures it. We don't know what causes it. We don't know when the next relapse is going to come, how long it's going to last, when it's going to remit. But if you utilize some of these tools in here, it probably is at least going to do no harm. And you might have a little more pleasure during the meantime, as well as success, not having as much mental stress, anxiety, depression. Another thing you might have read in some of the literature is that there are people that have had trauma in childhood that seem to have some higher incidences of MS. And one would wonder if those kind of stressors, now we're talking about things like abuse, violence, being victims of crime, are those kind of events stressing us to the point where we're actually doing some of these things like demyelinating. If we're having those cuts in that myelin sheath, that ends up scarring and causing those lesions and plaques. I know that a lot of the patients I've seen that are struggling with some of the disorders associated with MS in a psychological sense very often go back in this internal dialogue, which we have kind of a file cabinet down here. And we keep everything in that file cabinet. It's alphabetized, it's chronological, it's cross-referenced, and often when we're experiencing something here and now, some of you have probably been listening to a song on your radio while driving, and then all of a sudden, poof, we go to that file cabinet. And that song reminds us of some person, some place, some event. It can be a pleasant experience. It could be a tragic experience. But we also know that people with things like post-traumatic stress disorder, people who dissociate, which is like turning the screen off, that they very often are in those file cabinets and bringing things up that, again, they internally dialogue about. And those messages end up causing emotions and behavior. And so one of the things that I leave you with is that these inside jobs, as I refer to it, can oftentimes be diagnosed. We think about, getting physiological attention and assistance for our physical problems, but often we don't see as much of the physiological challenged folks that go and look for, what is my anxiety level? I refer to it on the last page, in the fourth paragraph, as this psychological blood work. Most of your physicians probably wouldn't give you a lot of medications unless they did physiological blood work. But what about your psychological status? How high or how low, or is your depression levels, anxiety levels average? And the same for anxiety, post-traumatic stress disorder, and things like ADHD, autistic spectrum disorder. And when you start looking at the similarities, one would wonder if compromised nervous system functioning, like we see in MS, also has some high correlations with other mental disorders and challenges. And so I would invite you, your partners, your family to consult someone that is a psychologist that can give you psychological evaluation and perhaps medication, not from a psychologist, but a psychiatrist, that could help you manage those symptoms better. And I appreciate you listening to me today and slowing it down just a little bit. Thank you for your attention.
Thank you, Dr. Preston. Does anybody have questions for Dr. Preston? I have one that came in online. I want to ask you this first, and then we'll see what else comes in, all right? Person wants to know that if he can't get his other half to listen to his problems, what should he do?
Well, that is a frequently asked question. And that's what I had hoped to talk about, which was an inside job. In my 40 plus years of being a marriage and family therapist, one of the most frequent things I see is that people will come in, and you'll have a brain surgeon married to a CEO of a Fortune 500 company, and I ask, what's your problems? And they'll both say communication. We can't communicate. And I'm like, well, how do you do those jobs? How do you do those jobs? And one of my old professors, back to your question, once said that watch for this, because very often people will say, I don't have any problems communicating with my partner. My partner has problems communicating with me. And so if you watch that point here and you work behind it, then that might be one of the reasons why your partner won't communicate with you. I wouldn't ask them.
Good one. Thank you. Next. Person wants to know, I guess she lives locally, she wants to know if you're accepting any new patients.
Yes, she can call my office.
Okay. Next. Can a person get addicted to a prescribed depression or anxiety medication?
The answer to that is yes. Specifically, anti-anxiety medications, if they are not regulated and if one's not taking them as prescribed, they can get dependent on them.
Is there an alternative treatment to be used other than a prescribed medication?
Yes,
Such
and
as?
well, again, working on some of those inside issues that have to do with the file cabinets, the internal dialogue, how you are getting all of this incoming data, where are you located, and so forth has a lot. And what do you bring up out of that file cabinet? All of those things certainly will help and a lot of times eradicate some of the anxieties as well as depression.
I think the person was asking, is there a nutritional supplement of some kind to use instead of using a prescribed medication?
Okay. There are a number of supplements out there that say that they eradicate depression or lessen anxiety. However, some of those can actually be dangerous. And some, like St. John's wort, is one of those that can sometimes actually create more problems than reduce them.
Okay, thank you. Next question. Do you think early psych trauma or other events can initiate MS either alone or in concert with physical illness?
My personal thought is yes. I believe that it's kind of like taking a 110 lamp and plugging it in a 220 socket. When people are abused, violated, so forth. And as I understand it, that's kind of what happens with some of our myelin when we start, it starts breaking down and we can't keep some of the neural signals contained. And so I see that very often with people that have been overly stressed or introduced to things like sexual experiences before they're developmentally prepared to deal with it.
Can a serious car accident cause this MS?
Ask him.
I got it. I got his question. Can a serious car accident cause this condition? I would say that is a legal matter more, but just as I was saying with the trauma, it certainly does have an impact on our nervous system, those high degrees of stress that we're not prepared for. The thing we fear most is the unknown and the unpredictable. And when they happen, I think our nervous systems are overwhelmed.
Any other questions? If not, I want to thank Dr. Preston and everybody else that's spoken here today. Thank you much. I do want to say thank you again to everybody that's online and thank our supporters, all of our sponsors. We mentioned them all earlier, and that's it. Time's over for all of you online. Thank you. Have a great day.